We are watching a system collapse under its own weight. Not because people don't care, but because a system built to care for the people has forgotten how to take care of itself. Everyone's working harder, and no one's getting ahead. Providers can't keep up. Payers can't see clearly. And the trust between them, well, it's worn thin. This isn't about bad actors. It's about bad connections. And if you're thinking, okay, but why should I care? Because we are all consumers of healthcare, and we are all paying for it through our paychecks, our premiums, and the taxes that fund Medicare and Medicaid. When healthcare wastes money, it isn't abstract. It's your paycheck, it's your premiums, your copays, your taxes. Now, when people hear the word waste, they often think fraud. Fraud gets headlines. Fraud gets takedowns and gets pitchforks. But here's the part nobody wants to put on a billboard. Waste isn't always fraud, and it's costing us far more. Estimates put healthcare waste at hundreds of billions of dollars a year. Fraud matters, but administrative complexity alone costs us dramatically more. So yes, fraud deserves our attention, but if we only chase villains, we miss the much bigger monster, the system itself. And here's the irony. One of the reasons waste keeps growing is that we increasingly treat everything like potential fraud. More reviews, more checks, more hoops. That's not a moral failure. It's a design problem. The business of healthcare keeps expanding, not because people want it to, but because the system demands it. Healthcare administration roles are growing rapidly as complexity piles on top of complexity. For decades, the back office of American healthcare has been divided. Payers on one side, providers on the other. Each working from different sets of data, different definitions, different versions of what is true. And the industry talks about it like warfare, battles, hardball, who's winning. Meanwhile, vendors line up to sell weapons to one side or the other, because chaos becomes a revenue stream. So what side does Trend fight for? We fight for accuracy, because accuracy is the one thing that can actually end the war. Accuracy removes rework and inefficiency, and it restores trust in how healthcare pays for care. Accuracy isn't partisan. It's principled, it's measurable, and it's achievable when both sides see the same facts. That's why we don't take sides, but we do take responsibility. The responsibility for helping the system work the way it actually should. That responsibility shows up in what we've built. We've built solutions designed from both perspectives. Solutions that identify, resolve, and prevent payment inaccuracies. For our payer partners, over 100 of them. That includes overpayment identification and recovery, credit balance identification and resolution, data mining like COB and ESRD audits, clinical and coding validation, and payer intelligence solutions. For our provider partners, over 1,000 strong, that includes denials management and prevention, credit balance resolution and prevention, and zero balance account analysis. All of it powered by a data-driven technology platform that brings payers and providers and their data together in one clear view, one accurate truth. Our solutions work because they're rooted in collaboration, not competition. We believe the future of healthcare isn't about bigger systems or smarter machines. It's about smarter relationships. Relationships built on transparency, on integrity, and on accuracy. Years ago, the idea of moving away from the adversarial payer-provider model was regarded as idealistic, a pipe dream even. But for 5 years, we've been proving that collaboration isn't naive. It actually works. In 2026, Trend became the first company ever to be recognized by KLAS Research on both the payer side and the provider side. And not just recognized, named best in class with the highest customer satisfaction ratings in the industry. This movement is real. This model is proven. And the way forward is very clear. People love to say that this kind of change is idealistic, but without a little idealism, nothing ever changes. And we can't keep waiting for political fixes. We can't keep waiting for industry players to operate against their incentives. Change starts in the only place it ever does, in our own 20 square feet. The choices we make, the language we use, the standards we refuse to lower. When accuracy leads, healthcare starts to work the way it always should have. We're Trend, part of a growing movement that believes accuracy and collaboration aren't ideals, they're necessities. This is your invitation to be a part of the change that makes healthcare what it was always meant to be. Will you join us?